With only 5% of the health department's budget allocated to mental health care, the current demand for services in the public health sector is outweighed by demand. Today is Mental Health Awareness Day, and in South Africa, accessibility, affordability and stigmatization are just some of the challenges for those battling mental health disorders.
In many communities across South Africa, speaking about mental health is a taboo. The fear of being written off as being crazy often leaves those struggling with very few options. Therefore, too many people who battle choose not to seek help.
Stigma around mental health conditions and symptoms even in the communities is incredibly prevalent. I think if anything, this is the biggest barrier to people accessing care is that, they're going to be stigmatized as someone who's sort of mal or got something wrong with them, or that they're going to be seen as crazy, and that's difficult because they're already confused and nervous about what they're experiencing.
Trying to break the stigma is Member of Parliament Akeso Clinic, who lives with depression, anxiety and ADHD. Mbele speaks of the pressure he felt to be silent about his illness.
And then eventually, when I reached a few breaking points over the years, and I had no other option, literally no other option for my own sanity and my own just sort of mental, emotional health, but to seek that professional counseling and therapy, the benefits and the clarity and the weight off the shoulders, and just greater happiness and headspace made me so relieved, where I was like, it's important to work on the destigmatization, as we did, with HIV and AIDS in the past 2 or 3 decades, because nobody else should have to put themselves through that much struggle and strain.
Mbele's colleague MP Nazli Sharif agrees that growing up in a society that doesn't talk about mental health issues, she didn't understand it. She said only later she was able to realize she battles with social anxiety.
Not only do I struggle with it, but I have friends and family that also struggle with it and oftentimes don't want to speak about it because of the stigma attached to it. But I do find that, with time progressing and, more young people actually coming out and speaking about their struggles, it seems like more people, are coming out and speaking about it. And that's why, I go to therapy. I go to therapy on a weekly basis to be able to learn how to cope better with my mental health, and also, to understand where it comes from, and how to cope with it, essentially.
In her work as an MP, Sharif advocates for more access to mental health resources. She and Mbele agree more funding is needed. While Williams, who works at grassroots level, has experience on the ground and says government needs to focus on a bottom-up process when it comes to funding and allocating resources. She says she regularly sees nurses in the sector inundated with patients on a daily basis, while waiting lists to see specialists are long.
There isn't one right answer, but if I had to say, from my perspective, I think the government should be doing a lot more listening. There's a lot of top-down campaigns and, relying on statistics and, implementing these broad health policies that statistics show, should work, but don't. And I just feel like it needs to be a bottom-up process where we're listening to the people in the communities as to what they need, what they believe, mental health policies need to include, and there just isn't that at this point.
Williams, Mbele and Sharif all agree adding to the current pool of social workers should also be at the top of government's priority list. But funding aside, all three appeal to anyone battling to reach out to someone to talk to. Abra Barbia, SABC News, Parliament.
For more, we're now joined via Zoom by Dr. Ryan Fuller, who's a specialist psychiatrist, founder and senior clinician of Memorycare Group medical practice at Memory Clinics at Akeso Clinic. Thank you so much indeed for joining us, Dr. Fuller. This year's theme for World Mental Health Day is Make Mental Health and Well-Being for All a Global Priority. When you think about that theme, what's the story in South Africa that's preventing us from making mental health and well-being a priority?
Thanks very much for having me on, and thanks for highlighting this very crucial topic. I think in South Africa, we get drowned out by so many other basic needs, basic services, power outages, water outages, crime. We just seem to lurch from crisis to crisis. And as your insert showed, unfortunately, mental health throughout the world isn't prioritized enough because of stigmatizing within political systems as well as funders. And so we need to do more and more. I think it's important to note things have got better if you look internationally across the world in the last couple of decades in the developed world. But in the developing economies, we really do lack and need much more emphasis. One of the biggest problems we face in South Africa is the lack of professionals, mental health care providers, not just psychiatrists, but as your insert showed, we don't have enough social workers at all, certainly not in state. And we must remember that it's a team-based approach is often the best one. Things like what we call allied providers, occupational therapists, clinical psychologists. But really we need nurses on the ground, healthcare workers who are trained in mental health. And you can't really separate it from the growing need to provide better primary level healthcare, I think.
The world we live in has been changing over time and decades, and I wonder, are mental health disorders on the increase, or is it just that they're better diagnosed?
Good question. No, I think they're on the increase. I think COVID, unfortunately, was a cruel international experiment, if you like. I think most experts would agree there was 1 in 3 people had new onset psychiatric problems when they were going through lockdown. That was across the world. It was more than just cabin fever. People struggled with insomnia, not being able to sleep, panic attacks, depression. And then it was quite interesting, approximately 2 months after the lockdowns were eased, we would see a massive surge of admissions in psychiatric clinics. And I think most of my colleagues would agree with that. There seems to have been a massive impact. We know, for example, economically, for every rise or decline in GDP, unfortunately, the suicide rate goes up by 1%. And so mental health is very closely linked to what's happening in the communities, unfortunately.
Is the penny starting to drop? Because, for years, if you can't see the injury, then it doesn't exist, used to be kind of how we looked at these things. Are we starting to appreciate that it is as serious as a broken arm or whatever?
I think so. I think there's a double-edged sword. COVID flattened a lot of the hierarchies, and overall, I think it shocked people into being perhaps a little bit nicer to each other. I'd like to believe. Hopefully, we don't go back to the way we were. People really have been shocked into understanding that the world has changed. I think social media, the fact that I can do this with you by Zoom overnight, we had to provide therapy using Zoom and other technologies, which is good. And I think social media has also raised awareness in a good way. There's still a lot of work that has to be done in schools about regulating social media and what it means to have a good, healthy mental health, defining that. But I do think mindfulness, the sort of movement to understand that your psychological well-being matters and it influences your physical health, I think overall that is being better recognized, yes.
More and more of us are starting to know and hear stories of people who have died by suicide. Is that an indicator of the type of mental illnesses that are increasing, that we're seeing more and more?
Yes, unfortunately, I think that is right. The obvious mental illness is depression, and not just a bit of blues or feeling a bit sad, but what we call a major depressive disorder. These are symptoms that persist for at least 2 weeks, most days of the week. There's subjective distress, objective distress, lack of functioning, low mood, inability to sleep, often with anxiety, panic attacks, feelings of guilt, worthlessness, and low energy levels. What we find is that men in particular struggle to ask for help. There seems to be this perception that, cowboys don't cry, and also that there isn't help available, when in fact there is. Through SADC is a very good helpline. I think Lifeline also provides services telephonically. A lot of corporates, companies have mental wellness programs. And so we find with men in particular, we need to raise awareness. Women also struggle, of course, not to say they don't struggle. But I think it's important to recognize that suicide is a symptom of major depression most times, and that it can be prevented with good awareness and early intervention.
The other thing that I've also observed, and I'm not a doctor, but I get a sense sometimes that things like alcoholism are not recognized as mental health issues, and that it's really just kind of a social problem. And I wonder if this is contributing to people not being diagnosed and actually dealing with it.
Absolutely, you hit the nail on the head. I mean, I think we call these escape behaviors, or maladaptive, unhealthy coping strategies, drinking, alcohol dependency, as well as other substances. We're seeing a massive rise in cannabis and other substances in schools in particular. The vaping as well is not as benign as people think it is. It's extremely dangerous. And you're so right. I think nearly all patients we see that end up, unfortunately, in a psychiatric clinic, many of them, approximately 50%, have got an abusive type of substance which needs to be actively treated. And you're right, there is treatment available. The standard detoxification is helping people come off alcohol with safer treatments. And there is medication to help people. But also, like I mentioned before, you need a good team-based approach with therapy, occupational therapy, clinical psychology, and the like. And so, but, as you say, it's a social problem. I think as a culture, South Africa drinks excessive amounts of alcohol relative to the rest of the world. And we don't do nearly enough in discouraging people from drinking. And we need to do more in that regard.
All right, we've run out of time, but perhaps a final thought from you that you'd like to share on this very important day.
Thanks very much. I think really it is to be kind and to remember that we should always be kind. I can't remember who said it, but we never really know what people are going through. And to be human is to have emotions. And so those emotions, we need to be kind to each other to allow those emotions to flourish in a good way.
Dr. Fuller, thank you so much indeed for your time. Thank you for joining us on the program to talk about this very important issue. Thank you.
Thanks for raising the awareness. Appreciate it.
Good night. All right, that's Dr. Ryan Fuller, Specialist Psychiatrist and founder and Senior Clinician at Memorycare Group Medical Practice at Akeso Clinic.